From Wish TV, All Indiana Politics
is your premier source for Indiana politics.
Focusing on issues that matter to you.
I still want us to be the best in the Midwest.
We can't afford another lockdown.
Give the citizens of this country the relief they need.
Education in the state of Indiana remains priority number one.
In-depth, nonpartisan coverage.
We don't know exactly where the economy will be in January.
People are worried with good reason.
Exclusive interviews with Indiana's political leaders.
We have the resources here in the state of Indiana to care for those who are in need.
Expert analysis on critical legislation.
We need to reform those laws.
This recovery is going to take some time.
We've got to anticipate that there'll be a budget shortfall.
From Wish TV, this is All Indiana Politics Podcast on the All Indiana Podcast Network.
I'm Garrett Bergquist, government reporter for Wish TV. I recently sat down with Indiana's new state health commissioner, Dr. Lindsay Weaver. Weaver took over from Dr. Kris Box on June 1st. She previously served as Indiana's chief medical officer. She took that job about 3 years ago, right as the COVID-19 pandemic began. We talked about her vision for the state health department, the new public health funding bill the state legislature recently approved, and her continuing work in a local emergency room. Let's welcome in Indiana's incoming state health commissioner, Dr. Lindsay Weaver. Dr. Weaver, thank you for joining us today.
Thank you for having me.
So how does it feel to be the next state health commissioner for the state of Indiana?
It's exciting, really big shoes to fill in Dr. Box, but we have a great team at the Department of Health. I feel really lucky that I have had the 3 years of experience that I have working alongside Dr. Box, working at the Department of Health, which I think will just make us roll right into the next phase, and we're looking forward to implementing the Governor's Public Health Commission.
And you still work in the emergency department at IU Methodist. Tell me a little bit about that.
I do. I work at Methodist every Tuesday, so the residents call it Government Tuesday. I love working in the emergency department. It was my primary love. It's the only thing I ever wanted to do since I was 5 was to be a doctor. So I appreciate still being able to go in. And I tell my team that I learned so much about public health when I'm working in the emergency department. They know when I come back into work on Wednesday morning that I have taken care of people with substance use disorder. I take care of new moms, pregnant women, people from all walks of life. And that really does help inform, what more could we be doing in our community to help people. I also say it's easier to work in the ER than it is to do public health because there's one person in front of you that maybe you can help when public health is much bigger and there's so many things that we can be doing and people to help. But it's fun. I like working with residents and medical students and staying in touch with what's going on in medicine.
What first drew you to medicine and emergency medicine in particular?
Well, like I said, I only ever wanted to be a doctor since I was 5. And I think it was because, I love science, I love people. And when it came to emergency medicine, I liked it because you really get to do everything. So you get to do a little bit of orthopedics. I get to be a cardiologist. I'm, taking care of people on the worst day of their life, and then often the worst day of their life, and what can I do to help make it better for them? Also, it's unpredictable. Every day is different. You never know what you're going to get. And the people are amazing. I mean, these are people who are true servants. They want to help take care of people, day in, day out, no matter what the situation is. No judgment for, whatever circumstance brought them there, but what can we do to make them better?
Do you plan to continue working in the emergency department when you become state health commissioner?
I do. I will continue to work 3 to 4 days on Tuesdays, just like I have been. I was able to do that even through the pandemic when we were working 12, 14-hour days at the Department of Health, but again, found it important. It also helps when I'm talking to clinicians across the state that they know I'm still a working doctor. I know what it's like to be taking care of patients. I mean, the drug shortages, all the other things that are happening in medicine right now that I really understand it, and I'm working alongside of them. So yes, I appreciate that, the governor's team totally, supports me. They want me to be able to continue to work. Dr. Rosiniak, who's the secretary of FSSA, he's also a still working ER doctor. Actually, at the peak of the pandemic, we had 4 ER doctors working in state government. So I think it's definitely, something about us wanting to do this additional service.
How has working in the ER affected your approach to public health?
sometimes you think when you're doing things in public health that you expect a certain outcome, right? So you try things, and sometimes they don't work, and sometimes they work great. But working in the emergency department really shows you where there are gaps, right? So I know that there's lots of services here in Indianapolis, but yet I'm taking care of so many patients that are not aware of what the services are, or we make it too hard for them to access that, right? So I always give the example, you want to teach new parents about safe sleep. You want to make sure that the child, the car seat is put in correctly, but those things are often separated from each other. So what can we do on our end to bring all of those services together for a new family so that they can learn about safe sleep, they can have someone check to make sure the car seat is put in, that we're sure that they have good resources, if they need assistance with food or transportation or whatever that may be, to make sure that we bring all that together. So I think that's what I'm able to see is really, where are the gaps in our healthcare system right now?
Will that be one of your priorities as State Health Commissioner?
Absolutely. So, with the Governor's Public Health Commission, we now have the ability for all of our counties to opt in to get more funding to improve public health in their communities. And we have been communicating that to our local health departments, but that's really what we see them doing, is being the convener, bringing together all the different services that are in their community and making sure someone's, overseeing that and knows. We have so many great healthcare organizations, community-based organizations that are providing really, really great services to their community, but they're in pockets. So how can we make the connections? How can we fill in the gaps?
That was going to be another question I was going to ask. That public health bill will become law on July 1st. Tell me a little more about how you plan to implement that.
So we've already started working on implementing the process of the Governor's Public Health Commission. We were optimistic that this bill would pass, that our legislators would agree with us. This is an opportunity for us to invest in health in Indiana, and thankfully that they did. So we've been working on this since last fall, working with our local health departments, public health leaders, to think about what does this look like, because we knew that if the bill passed, it would go into law on July 1, and we'd have to hit the ground running. So right now we're working with our local health departments to develop key performance indicators, right? So we don't want to just do things, we want to measure them and make sure that it's making a difference, because if it's not, then that tells us to pivot. If it is, then we want to spread the good news and let other people know that this program's working and this is how they invested in it, this is how they're partnering with it. And our local health departments have amazing ideas. There's already a lot of good work that's going on out there. So just honestly, this process of bringing them together to develop the key performance indicators together has already been leaps and bounds to where we were several years ago, and that we're getting them to collaborate, share good ideas, and plan for the future.
You became chief medical officer for the state just a few weeks before the pandemic began, COVID-19 pandemic. What are some of the chief lessons from that specifically that you want to apply as state health commissioner?
So we either had the best timing or the worst timing, depending on how you look at it. So started February, the first week in February of 2020. And as soon as I arrived, they were already, they had incident command running, they were preparing, they were talking about COVID and us, preparing for when the cases would come. One of the very first things Dr. Box asked me to do is she said, I need you to communicate to all the clinicians across the state. So day one, I was planning for 5 days later to do a webinar for all of the docs in the entire state. And then honestly, from that point forward, was all in COVID for a good year and a half. I always joke that I was in the position for 2 years before I really knew all the things that public health did. I would say my biggest lessons that I learned from it, one, very proud to be a Hoosier. I talked to my colleagues from across the country, and they just didn't have as much support from their businesses, from their community, even from their elected officials that we did here in the state of Indiana. So I think that was probably the best thing. And two, part of that is how important collaboration was. So I was talking to, leaders for our big universities, leaders at our biggest businesses, leaders for our small businesses, and really talking about, how health impacts their everyday, right? It impacts their business, it impacts the well-being of their employees, and that's the same thing that we want to continue here with the governor's public health implementation, right? Health really matters to all of us, including the economics of the state, which we do great in. And I think thinking about health on top of that is really, really important. So I think those are the two things we'll be taking moving forward.
How has the relationship between the state health department and the county health departments evolved since the pandemic? Obviously, this partly goes back to the public health bill we discussed earlier. What are some things from that, more the pandemic lessons, that you'd like to carry forward in that regard?
We really learned that the local health departments didn't have the opportunity to share ideas with one another previously. So they were all working, 94 during the pandemic health departments were working kind of in silos, doing their own thing. Public health people are amazing. They put their head down and they just get to work. That could be isolating in some ways. And then also people aren't learning from one another. So one of the things that we did throughout the pandemic was, host calls where we're bringing, all the northern local health departments together, all the central, all the southern, so that they can hear from one another, hear what struggles they were having, what were they worried about, what were they doing, what were they implementing, and really getting them the opportunity to get better with that collaboration. I mean, some of our local health departments don't even have a full-time employee. So you have, 3 part-time employees that are trying to do this great work. So getting the support and hearing from some of the bigger health departments, and it also works vice versa, learning from each other, I think really helped them know that they weren't alone, that there was other ways of thinking about and doing things, and also introduce them to new partners.
Trust in public health has dropped in some quarters due to the pandemic response, and a lot of that goes back to a lot of the mandates and shutdown orders that came as a result of the pandemic. How do you repair that loss of trust?
I think people for the first time really know about public health. Again, these people are, hardworking service who just really want to improve health in their communities. And a lot of people weren't even aware that there was a local health department, that there was a state department of health, and the things that were happening behind the scenes every day to protect all of us, that the food that we eat is good, that the water we drink is good, that if there is a infectious disease outbreak, which there are always infectious disease outbreaks, just little pockets everywhere here in Indiana, across the nation, but that our team is engaging on so that it doesn't spread, so that it doesn't become a problem. I think that the pandemic was a hard time for everybody. It was a hard time for me, my family, my friends, my colleagues, Hoosiers across the state. And so there are just a lot of not great memories about that time. I think what people need to understand is that early in the pandemic, we didn't have very much information. Nobody really did. So everybody was trying to do the best that they absolutely could to save as many lives as possible, to protect as many people. And I think just reminding people that that is really what public health is about, right? We're here to make sure that we can all live the absolute best lives that we can. And then, that often comes with recommendations, services, and things that we honestly often take for granted. Like we forget that somebody's going into the restaurants and making sure that the food is good. We forget that there are people that need to be out there talking about don't text and drive, that, bike helmets really do save lives. We need those people doing those things. And it's really important. And we know that it works. We know that we are saving Hoosier lives by implementing, these different programs.
Indiana ranks very low on several public health indicators. What do you believe are the most immediate concerns based on what the Governor's Public Health Commission found? We
have so much opportunity. So one of the things that we're talking about right now is really focusing on the prevention piece. So Indiana is 12th highest in obesity. 2/3 of Indiana adults are overweight or obese. 1/3 of Indiana teens are overweight or obese. So what can we do now to really work with those young people so that that number doesn't grow any further? I mean, people think, of course they know with obesity, higher risk of high blood pressure, higher risk of diabetes, but it also increases your risk for some cancers. It makes it more difficult to heal from a regular surgery or from an infection. It really does affect your everyday life. I mean, even there's studies that show that it affects your ability to work. So what are we doing now to really be talking to our youth, implementing things to make sure that they have, physical activity in school, physical activity after school, access to good, healthy foods, that we're communicating about, how to plan a healthy meal and all of those things. So obesity is one of them. Tobacco prevention and cessation, that's something I'm really excited about. Again, our tobacco prevention cessation coalitions that we have across the state do great work. They have driven down teen smoking down to 4.2%, which is amazing. Unfortunately, vaping has increased to 20%, almost 20% in our high schoolers. So we only have those coalitions in 38 of our counties. So one of the first things we want to do is say, let's at least get somebody who's thinking and talking about tobacco prevention cessation in every single county. Let's grow that from 38 to 92 counties. So someone's out there thinking, talking about it, working with teens, so that we can start seeing those vaping numbers come back down.
Well, that was in the public health bill.
Yes, it was in the public health bill. We are, also are going to be addressing infant mortality. Dr. Box has done, really in her team, tremendous work over the last several years to implement My Healthy Baby. My Healthy Baby is now in all 92 counties to help direct pregnant women who are on Medicaid to have a family support person. They have the Pregnancy Promise program for pregnant women who are suffering from substance use disorder. They actually just enrolled their 500th patient this week, which is really, really exciting. So continuing to build upon the programs that were already there and then grow the other programs to make sure that we're covering every single corner of the state.
What do you believe is the biggest misconception that people have about public health and the state health department in particular, and how do you plan to address that?
I think people do really associate it with, regulations. I think people probably don't realize that a lot of the things that happened during COVID were more locally directed, and so I think there's just that connection there. I think what I want to instill in people that public health has been around, here in Indiana, for over 100 years, right? This is not something new. The things that have improved our life expectancy over the last century have been all public health things that have happened, right? Access to vaccine, to decrease measles and mumps and rubella, access to, like I said, clean food, making sure that people understand how to protect themselves when there is a pandemic, when there's a flu outbreak, or whatever that may be. So I think that's really what I want people to understand, is that we really are here so people know and have the ability to live their best lives and be healthy. So you don't have to worry about exposures to different infectious diseases because we're helping control outbreaks. That you can be confident in your everyday life, that there's people that are thinking about your health and implementing programs to make sure that that's better, and that we're here to do prevention. We really believe that we can make a healthier Indiana, and a healthier Indiana is better for all aspects of our lives: work, play, bringing more people into the state, growing our economic development. Health is the center of all of that.
Dr. Lindsay Weaver, thank you for joining us.
Thank you.
That was Dr. Lindsay Weaver, Indiana's new state health commissioner. All Indiana Politics airs on Wish TV every Sunday morning at 9:30. I'm Wish TV government reporter Garrett Bergquist. Thank you for listening.
From Wish TV, this is All Indiana Politics Podcast on the All Indiana Podcast Network. Watch All Indiana Politics live Sunday mornings at 9:30 on Wish TV and at wishtv.com. Subscribe to this podcast and listen weekly here on the All Indiana Podcast Network. And be sure to discover even more great podcasts at allindianapodcastnetwork.com.